President of Indonesian Psychiatric Association, Dr. Gina, Dr. Leo, Dr. Hervita, and colleagues from Indonesia, and maybe also from overseas. Good morning, Prof. Sartorius. Thank you for joining us from Geneva. It's an honor from us to have you here with us today. We eagerly want to learn so much thing from you. I'm Dr. Santi Rajasi Tanggang, the President of Indonesian Early Career Psychiatrists from 2019 to 2022 as the chair of this webinar. Welcome to our webinar, our joint event from Indonesian Early Career Psychiatrists and Indonesian Psychiatric Trainees Association with the theme Building Resilience through Existentialism, Idealism, the Reality and Capacity in Transition era among psychiatrists in low and middle income countries. We know that having just entered the third year of the pandemic, people all around the globe of our backgrounds are faced so many obstacles. And to no exception, these effects are young psychiatrists as well as psychiatric trainees too. And we deal situation entail the transition in how psychiatrists in the future treat a growing population dealing with psychiatric issue and how we can adapt with the situation. And this webinar will provide an opportunity from Indonesian psychiatric residents and early career psychiatrists to discuss the matters regarding the various roles of psychiatrists play during a transition era and how we can adapt with this situation. And we would also thank you very much for the support from the Blue Division of Mercy Pharma Indonesia, Elsion and Lamiros. And in this webinar, we will have two presentations from Dr. Gina and Dr. Leonardo about how to start a new career as a psychiatrist in the post-pandemic world. And then we will learn from the inputs from Prof. Sartorius and Dr. Dia and continue with question and answer. And we can proceed to the first presenter is from Dr. Gina. Dr. Gina, we will have 10 minutes from the presentation, and Dr. Gina is one of finest young psychiatrists in Indonesia. She is also a lecturer in Psychiatric Department of Medical Faculty of University of Indonesia. Her main field is community psychiatry, and she's actively involved in many activities such as research and clinical work. Dr. Gina, the time is yours.
Thank you very much, Dr. Sati. Good afternoon for Dr. Dia and good morning for Prof. Sartorius in Geneva, and good evening to all the participants in this webinar. I would like to share my material. Hopefully it can be presented quite well. Okay, so since I've been given 10 minutes in this precious occasion, I would like to share a story about my journey in being a psychiatrist. At first, it started as a childhood dream, and then I took some years to pursue the degree during my early years of adulthood, and then I've spent the last 5 years to build my career. So yes, I wanted to be a psychiatrist. But then the time goes by, and it's time for me to reflect on my journey while being a psychiatrist. So this occasion is very much special for me personally, because I've learned so much from Prof. Sartorius in the past 5 years. And this year marks my 5th year as a psychiatrist. So this opportunity is really a good time for me to look back and then to look forward for what I'm going to do next. And on this presentation, I would like to share a story about how I live my life as a psychiatrist from a personal reflection perspective. And I am here today on behalf of the Indonesian Early Career Psychiatrists. Of course, there are many people who helped me to went through the trainings, the experience building my career path, including people from the Department of Psychiatry, Faculty of Medicine, University of Indonesia, and then the Cipto Mangunkusumo Hospital. There was Dr. Vita, and then all the senior teachers there. Also Dr. Dia, who helped me a lot to build my professional personality within the Indonesian Psychiatric Association, and also for colleagues in Indonesian early career psychiatrists as well, who helped me develop myself to be where I am now, and hopefully we can learn together and work together to be a good enough psychiatrist and contribute to our society. At first, I'm going to start with my early vision of being a psychiatrist. What did I have in my mind when I wanted to be a psychiatrist? During my early years of life, I imagined of having a flexible hours, working in a private practice to help people solving their problems in a good way. And then back then, I only thought about dealing with individual clients, and I will have an ideal time management when I can spend a few days to do clinical teaching activities. And a part of all these activities, I imagine myself to do some consultancy activities with the stakeholders to improve the community health status. However, the reality helps me to realize that life is never that simple, that the life of a psychiatrist that I imagined was not that simple. Because during the residency training, during my earlier period of becoming a psychiatrist, I was exposed to various school of thoughts. I was exposed to various values, principles, styles, experiences, and attitude. Many scientific events, many cases that I've encountered in the clinical practice, many interventions that I've seen from the seniors, from the teacher from other countries, other schools. And then during the clinical practice, I also learned how people respond to problems. We can encounter similar problems, but then giving different responses. And I also learned about how people deal and handle and solving that kind of issues. Until in 2017, if I remember it correctly, in 2017, I was lucky enough to get into one of Professor Sartorius' talks during the World Congress of Psychiatry. And then I was struck by his talks at that time, that I learned that as a young psychiatrist, what we need to do is do the work for the destigmatization of mental illness. And then we need to influence policymakers. We also need to search for connection, and we need to be sure of ourselves about what do we know and about what we can do. Because by knowing what we need to do, by knowing what we can and what we already have right now, that's how we can develop ourselves and reach our goal. So based on this exposure, this meeting with many people, my vision then going into an evolution. Until at my first year of being a psychiatrist, I decided, this is my days of decision, the day that I set the goal, what I'm going to do as a psychiatrist. Back then, I was quote unquote forced to talk to myself, to set myself about what kind of things that I would like to achieve as a psychiatrist, and that is to create mental health system that brings infinite experience to all. Because based on my previous exposure, I already fall in love with the community psychiatry field. And by that kind of vision, I decided to work in urban setting as an academic practitioner, and also joining the community and professional organizations to do all the things that I need to do as a young psychiatrist. But I'm still doing a private practice, so I can see what kind of things that is available on the other side of the world of being a psychiatrist. However, living my life as a psychiatrist, I have a linear expectation of being a psychiatrist. Hopefully everything will going well as we all expected, but the reality sometimes is not as easy as we thought and as not ideal as we thought. There are many pebbles and stones that I encounter in my professional journey, but to become a psychiatrist, to become a clinical teacher, and to become an academic researcher as well. What I learned from this journey is the pebbles and stones, the barriers, the challenges can come from ourselves, and it can come from out of ourselves. From the inside, it is important to us to know what kind of personality that I am. What is my limit? We need to get to know our ego. Then, because by knowing that, we can know what kind of things that makes us impatient. How do we handle our greed? How do we deal with laziness? How do we cope with stressors? What do we have in mind, in heart? What kind of things that we believe? Because by knowing all these things, then we will know exactly what we need to do, what we need to achieve, and what we need to learn more. However, while doing the job as a psychiatrist, there are also the extrinsic factors that might be a challenges for us. It can be the system, it can be the regulation, it can be the policy, financial needs, our family, our friends, and then the available resources to do our job, and then social structure, etc. There are many things that sometimes makes me frustrated. I will ask myself whether I can do this job, or should I just give up and do something else? And if we don't manage these barriers well, it may lead to the frustration. It will brings out to burnout state that many of our colleagues already complain about, and I experienced it several years ago as well. And sometimes I need to check on myself whether I'm going to the limit or not, and it can eventually decrease the quality of our work. So it is important for us to develop learning attitude so we can adapt and respond accordingly. There are many things that I've learned from Prof. Sartorius and other professor from the scientific events. Then also my teacher in Indonesia as well. We need to make, sometimes it is important to consider what kind of choices that we would like to make. And it's important in making choice, we choose something is relevant, something is understandable, and something is attainable. It's related to our work. And also we need to set the priorities by doing the reflective practice, which is to care for our own, to be aware of our own limitation, and seek support when it's needed, and also nurture our own health. Some things that we need, sometimes we forget about this. And we need to learn beyond our discipline, because once Prof. Sartorius said that we cannot work on ourselves, we need to learn work through others. And last but not least, to adapt and to respond well, we need to have patience as a young psychiatrist, because everything has its time, including ours. We have our own time on achieving things. So this fifth year is marking my next chapter as being a psychiatrist, to be a mid-career level. And it's important for me to always remember how to do self-reflection, review my goal, and set up my goal. But it's also the time for me to be specific about what kind of things that I would like to go deeper, to dive, and then to expand the skills in that field as well. And last but not least is remember to be kind. Be kind to myself, be kind to others, be kind to the juniors, and continuing the mentorship activities that's already been done for the past 5 years. But not only I'm getting a mentor, but also I need to learn how to become a mentor so I can help other young psychiatrists to grow as well. So based on this sharing, I would like to remind myself, and maybe many of us, to look back, see what we did, see what we wanted, and to look forward to set what we want to do next. Thank you, Dr. Sati. I'll give it back to you.
Thank you, Dr. Gina, for the excellent presentation. And we now proceed to Dr. Leonardo Laleno for his presentation. You have 10 minutes, Dr. Leo. The time is yours, please.
Thank you very much, Dr. Sati. I'm going to start my screen. Good afternoon, Dr. Norman, Dr. Dia, Dr. Sati, Dr. Gina, and also I see some of my friends and also my teachers here. I'm very humbled and very honored to be in this very memorable and respective occasions. So I'm going to share some of perspective from the perspective of the resident trainee. So my name is Leonardo, and currently I'm the 4th-year psychiatrist resident trainee from Faculty of Medicine, University of Indonesia. And I'm also currently the president-elect of Indonesian Psychiatric Trainers Association. And my presentation was taught from a very place that I call home, or in Bahasa Indonesia we call rumahku, or in French we call chez moi. My home institution is what I call and I perceive as home because that's the place where I grew up. I grew up as not only biologically, but also physically and also mentally. This is the place where I learned a lot of things that prepare me to be a future psychiatrist. And I'm very thankful to be in this home because that's the place where I can be in this position now. So today's sharing, I will talk about firstly on the opportunities. I will start with a very tricky and intriguing topic that is the COVID-19. And thankfully now we are entering to the end of the pandemic. But I think the reason why I choose the pandemic situation as the opportunity because this is the place where I myself personally I learned a lot of things, not only to know about the whole aspect of the humanity. It's not only about how to apply the psychiatric in the real setting, but also to know mostly about myself and how to prepare myself. So there's some reasons why we call it as the opportunity. And during the pandemic session, during this pandemic, it's hard for us to travel. And thankfully, we have this Zoom meeting where we can travel from one place to another. From here, even if I stay in Jakarta, I can still make a webinar with my friends in Sulawesi and back and forth. And today also is a special day in Indonesia, the Pancasila Day. This is the fundamental of the country. And also during this pandemic, we learned how to do a sharing knowledge and experience with the spirit of unity and togetherness as it is stipulated in the Pancasila, the fundamental of the country. And I think this is the opportunity to know that everything is beyond the distance. I mean, we can do many more things that we never do while in the pre-pandemic era. And also, other things that I hold as the opportunity to learn is to learn and apply about the situation. What I can perceive during the COVID-19 pandemic, it is for me personally, I perceive it as the living laboratory where I can learn to exercise the resilience and also practicing and elaborating all the theories that I've learned during the course and the training in daily life and also helping the patients. I also perceive that the pandemic situation is a great teacher for me, helping me to adapt with uncertainty and to accept the things that I cannot change. So the pictures on the right is the representation on how I myself dealing with uncertainty and also about exposing myself to all these things that scares me a lot. Exposed with the risk of transmitted with the COVID-19, but also exposed with regulation and government, and also exposed with all the things that I avoid a lot, which with my past experiences, and also helping me a lot how I can deal and befriend with my fear, my doubt, and also my insecurity using the principles of existentialism, the freedom, definitive, relatedness, where I combine them all together, I will find the meaning. The next thing that maybe I find it's interesting is about perceiving the challenges during my training up to now in the 4th year. I do some quiet moment of reflection, and I see that the most important thing for me is basically how to deal harmoniously with myself, because the challenge I understand is not from the outside, but it's within myself. So it's about, in the perspective of the psychoanalytic theory, it's about how to make myself more cohesive in dealing with stressors, in dealing with uncertainty. And I think that is the very most and fundamental things that I need to prepare and to cultivate within myself in order to be a resilient and also better psychiatrist, a future psychiatrist. I know that cultivating all these things needs and requires a consistent and resilient and internal working process to help me to create corrective emotional experiences, and also to extend my plasticity of the brain to making a new reconstructions on how I perceive the situations. But also these trainings, the life-giving training is also needs commitment, persistence, and eagerness to be a better version of myself. And the next question is, and what to prepare after see all the opportunities and also the challenges? Then I think it relates with the previous slides. It's about broadening and expanding my perspective about some things. I'm using these illustrations using the lens camera to see that using our perspective of our mind, the lens is the representations of our mind. So we can use vertically, horizontally, or we can use any different angles to see and to have pictures about the situation that we can perceive, that we can find a meaning, and that we can, using our executive function, to make a decision on how to behave, on how to react, and how to make a coping mechanism during the situation. So to conclude, what we can prepare, there are 5 things that I found from my experience as a resident trainee that is very relevant. That is, the first one is the commitment for change, the commitment to heal. The second thing is about motivations. The reason, as Dr. Gina mentioned before, the reason why I choose psychiatry, the reason why I spent my 4 years living with patients with mental illness, and the reason why I learned a lot about mental and mind, and also about integrity, about myself, about being fine and being good and being enough with myself, and also how about to establish the goals, and above all, how to find meaning in every situations. So the last questions that delivered for the sharing is, again, how to deal with uncertainty. I think we have been seeing about some things that we need to prepare. So I want to quote a very beautiful theory from the Frank Summers, and also the other expert, the William Earl, about transcending the ego and the self. So I found that it is a very comprehensive internal working process where I can grow myself a more adaptive and cohesive, but also my ego also works together to work together with the super ego and also with myself to make a better version of me. And I know that this is a very long process, and this is a very continuing process up to now. And I think that's the fundamental, and I think that's the key and the core, the thing that I need to prepare myself for a better future. As Dr. Gina mentioned, there will be also uncertainty, but I think if I prepare myself for the change situations and I can reflect back on myself, then that is the key for getting better with myself. So this is the conclusion for today presentations, and I quote the quotes from Dr. Frankl that says, when we are no longer able to change the situation, we are challenged to change ourselves. So thank you very much, and terima kasih.
Thank you very much, Dr. Leonardo, for the insightful presentation. And Dr. Leonardo is a 4th year of psychiatric training in University of Indonesia, and he also the president of Indonesian Psychiatric Trainees Association from 2019 to 2023. So he currently live in Jakarta, right? Okay. And now we proceed to the response from Dr. Dia, the president of Indonesian Psychiatric Association regarding to the presentation from Dr. Gina and Dr. Leo. Dr.
Yes.
Dia, you have 15 minutes, and I would also like to introduce you as Dr. Dia is a current Indonesian Psychiatric Association from 2019 to 2022. Her lifespan career is so amazing, from the Indonesian government officer and now to the deputy of narcotic National Narcotic Board, and also now she currently active in as a lecturer too.
Lecturer, yes. Right,
The time is yours, Dr. Dia.
Okay, thank you, Dr. Sati. Good evening for Professor Sartorius, and also good morning and good evening for everyone. And thank you for inviting me in this webinar. And after I listen for the two presentation, yeah, it's very nice presentation from Dr. Gina and Dr. Leo, and I get some message from both of you, especially for Dr. Gina. So you are fortunately you have a goal, or you have you mind you have, what is it, like yeah, when you're in childhood you think that you will be a psychiatrist. So when you got training for psychiatrist, your soul and your motivation, it's I think it's the best one for force you for being a good psychiatrist. And so I know, but being a psychiatrist is in Indonesia, we have to struggle with the destigmatization, not just the stigmatization for our professionals, but also the stigmatization professional from the others, specialists like internal and others. So they think that you know, and psychiatrists just giving medication for the people with the mental health illness like a schizophrenia, bipolar, and others, psychosis, and yeah, they think that psychiatrist is like a second level of specialist in Indonesia. This is our yeah, our full position. But right now, yeah, currently, I think that or other specialists, we are thinking that psychiatrist also has a wide what is it, wide perspective in the human being, not just as a mental health disorder, but also in the others situation, especially in pandemic. You know that we psychiatrists has a big challenge to do something in doing together with the other specialists to fight with the pandemic. And I also agree with the factor that influence our self as psychiatrists. It's both intrinsic and also extrinsic factors. And the harder is how to cope with our intrinsic factor. As you mentioned, like ego, being impatient, how to reduce our ego, or how to cope with many things, many problems, and also yeah, but not this as about the finance. Yeah, we know that as a psychiatrist, our yeah, some of our colleges has a finance problem, because in our country, psychiatrist is like, yeah, like what is it, like space. Yeah, I think that I name it is like a second level of specialist. So it's they just send they just refer the clients after they give what is it menyerah give up, yeah, after they give up to give the medication or to treat them. This is from Dr. Gina, and the most important thing, yeah, for Dr. Gina presentation in about how to adapt and how to respond this situation, yeah, and also as Dr. Leo mentioned, yeah, we all of us is facing with the situation we call it VUCA, yeah. Volatile, uncertainty, yeah, complexity, and ambiguous. Yeah. Anytime the situation could be changed, and we have to be being adaptive with the situation, and we have to respond the situation with our coping mechanism. And Dr. Leo, yeah, we are very lucky. We are very lucky have a Pancasila, so we are still unity in the diversity, and this is the our way of life. Yeah. And yeah, as I mentioned before, uncertainty, yeah, making we have to dealing with the uncertainty, doubt, fear, insecurity, and others negative sensation. But believe it, we can pass this situation, yeah, with our adaptive mindset and also adaptive behavior. Yeah, and you also present about what to prepare to be the future psychiatrist. There are a commitment. Yeah. Yes, that's right. Commitment, motivation, integrity, goals, and meaning. Yeah, and the most important thing is about integrity. With integrity, you can stand everywhere, in any position, in any condition, in any situation. So, and I agree. So, how to deal with uncertainty? Yeah, grow more adaptive. If you can adapt in adaptive with this situation, you can be not just good psychiatrist, but a good person, and a person who can do everything. Yeah. Just remember that whatever the position, whatever the situation, do your best. Yeah. We not need to get the mention from the others, yeah, that we are a good psychiatrist or good person, yeah. But you just doing your job, yeah, but to do your best, yeah. I think everyone know about you. Yeah, this is from my experience. Yeah. Actually, I don't mind that I will be a bureaucrat. When I got a training in psychiatrist, I was saying that I will be a clinician working in the hospitals and dealing with the clients. Yeah. But God always arranges everything for the people. And like a flow of the river flow, I just running my job, and whenever or whatever my position, I try to love my tasks my duty. And Alhamdulillah, thanks God, as a official government, I had the highest rank as deputy, is echelon 1. It is the highest rank from the official government in the rank of the whole. Without I'm arranged before. I just do then whatever my position, and running like a river flow. Okay, thank you very much, Dr. Gina and Dr. Leo, for your presentation. I believe that both of you will be best psychiatrists in Indonesia. Okay, success for all of you. Thank you very much, Dr. Sati.
Thank you very much, Dr. Dia, for your response and your insightful opinion for us. I think it's give us also inspiration to be a better psychiatrist in Indonesia. Thank you, Dr. Dia. And now we proceed to Prof. Norman Sartorius, and I would like to introduce him first, but I think you can Google him. You can find many accolades and many achievements that make you amazed what has he done in his life, in his career. But for me personally, 2015 in Fukuoka is the life-changing moment for me as a psychiatrist and also as a person, because after I joined his leadership program in Fukuoka, I acknowledge my limitation, I acknowledge my strengths as a model to be a good psychiatrist, especially to be a better person. So now I hope the insight from Prof. Sartorius will also help you to acknowledge yourself. Please, Prof. Sartorius, the time is yours, 15 minutes.
Thank you very much for the invitation, and thank you also for your kind words. I want to first congratulate you and the Association of Young Psychiatrists in Indonesia for this initiative. I think that it's a wonderful idea to bring people together and to, if they cannot come together in person, at least to have some opportunity to see each other's face and to talk to one another. I think that I'm delighted to see that there are so many people who have inscribed themselves, and I see that the numbers, if I count this rightly, has reached all the 160, which means that everybody who has registered has come. This is amazing. Normally people register and then they go somewhere else. But this time they have registered and came. And that is something that is also encouraging, I think. I think it's a wonderful idea to have not only one, but to think about having a series of such meetings. And maybe after the 3 meetings that you have currently planned, you will consider to continue with this kind of a meeting, virtual meeting, which could continue even when there is no pandemic. We should not wait for a pandemic to start liking our friends. We should like them all the time, with pandemics and without pandemics. So the closeness brings the heart closer. So I think that it should be, these meetings should continue after we have. I also have spoken to, I think to Rita recently, and I do hope that it will be possible for us to organize a course this year, maybe towards the end of the year, and in November or whenever. And that would be a wonderful occasion to perhaps meet some of you who are currently in the audience and see some of the friends whom I have had the pleasure and privilege to meet in the past. Now, the people who spoke made some points which are very important. The first one I thought was, in addition, I wanted to congratulate both Gina and Laleno for the quality of their presentation. I think the slides were legible and they spoke well, and I'm very pleased to have had an opportunity to listen to you. So please continue doing and improving yourself further. There are some points that were mentioned which I think are of great importance. One of them is why go into psychiatry? And I think that now worldwide, the number of people who have gone into psychiatry has changed. While previously a large proportion or the majority of people were psychiatrists were males, now the profession of psychiatry is practically all females. And particularly the young colleagues, they move into psychiatry. Now, I was thinking about why is this so? Why has psychiatry become so terribly popular? It cannot be the subject alone. And some of the reasons that have been becoming quite clear is that people go into psychiatry because they feel that there will be more flexibility in their life. And since women have so many tasks in addition to their profession, having a bit of flexibility is a great benefit. But you have to pay on the other side with some disadvantages. And one of the disadvantages is that psychiatrists are not respected much by the other doctors as others. A surgeon is a real doctor. Psychiatrist is so-so. It is also a doctor, but less respected. So that there is a gain on the side of a little more flexibility, fewer night duties, and more arrangements. But on the other hand, one is in a profession that one has to really think of improving and adjusting. And that brings me to the word adaptation. I think that in her comment, Dr. Dia drew attention to the word, to the adaptation. And the choice which is always between every one of us when we are feeding a situation that is difficult, we have two possibilities, or in fact three, but basically two. We can either adapt to the situation, or we can adapt the situation. We can change the situation so that we fit into it a little bit better. And much of the progress in mental health and in psychiatry has been by not adapting to the situation, but by changing it. Now, none of you, or maybe they will, but by and large, it is not likely that we will change everything. But even small changes can bring the change the situation in which we are living sufficiently to make it a pleasant experience and to live in it a little bit better. I think that the other point which Gina made as well was the question of how to, whether you can learn from your mentors. And gradually one now understands that every one of us should be a mentor, and that we should be mentors in different ways. It is the mentors previously been seen as the almighty person who knows everything. But there are very few people who know everything. Most people know something. And being a mentor may mean that in fact we help people where we are strong, where we know how to do things, how we can help them. And in this way, if we all do it, I think that the mentorship will happen even if there are no terrible wise men who know everything in the world. One point that is, however, very important in thinking about this is you have a selected psychiatry, and now you are sitting there, and the question which you should ask, you don't like what you're doing, for example, there is the first choice is to say, all right, I will adapt. All right, so that's a little bit. Then the second question is, I will adapt the surroundings a little bit. Maybe I will change the place where I work, or I will change my preference, or I will try to see whether I can get a new relationship with my colleagues. So that is the second possibility. So I've adapted a little, and I've adapted the situation a little. But sometimes you will discover that although you have adapted, and although the situation has been changed, it's still not tolerable. It's still difficult. It's still miserable. And here you have to question yourself whether you really want to stay in that job or go somewhere else. And you should never think that it's too late to make a major change. Major change is possible at all ages, not only when you are young. Because if you, for example, say, oh, I've now finished my postgraduate degree, I am a psychiatrist, I know all of this, and now I must stay in this position. But remember, you have 40 years of being in your job, and you must think of whether you will have 40 years that you like or 40 years that you will not like very much. So that the consideration of adapting yourself, adapting the situation, and also exploring what other opportunities are there around me. Can I do something within psychiatry which is a little different from what I'm doing now? And having that constant awareness of being, selecting things that I like, helping people, being a mentor, somehow makes you also a better person and a more useful person for society. I think that the other point that is of importance was something that Dr. Lalenom spoke about when he said we were separated from one another by the pandemic. But on the other hand, in many ways, the virtual presence protects you from many things that you don't like. You do not telephone people whom you don't like. When you are at work, you have to meet them. So the pandemic is for many people a very enjoyable, not when they are sick. And of course, they have a feeling about people who are not well. That's apart from that. But for them personally, it's quite nice because they can avoid things they don't like. They don't like going to meetings. No meetings now anymore. They don't like meeting somebody. Oh, it's a pandemic. I cannot go there, etc. And one important thing that we should remember is that we should not take the pandemic as an excuse for not doing what is not so very pleasant. Some things that are not so very pleasant have to be done. And pandemic or no pandemic, one has to continue doing it. And in a way, I think that a virtual presence allows you to meet whom you like. But in real life, you have to meet many people whom you don't like. And I think it's very important to be able to be with people who are very dear to you, people who are maybe important, but not so very close to you, etc. To have the total people around you as being your contacts. It's not allowable to be exclusively concentrating on some people. And writing an email to somebody who is sitting next door to you is not a good idea. You are avoiding a contact, but you are losing something because perhaps the contact with the person would allow you to make a friendship or at least a tolerant situation with such people. So never take the pandemic as an excuse for interrupting relationships that you have. Try to improve the relationships rather than avoid them. Now, I think that Dr. Lalenom also mentioned something about what is a home situation and what is a home. And there is a German writer many years ago who defined what is your home country and your home. And he says a home is where there are people who like you. And I think that that is a great truth, but that also means that you have to contribute actively to making a place your home, that you have to continue developing relationships with people around you. And if it's impossible to do it by walking and by seeing people, do it by telephone and by virtual and by all of these things. But now that the pandemic is over, increase the amount of time you spend with people who are around you. just give them more time. Do not take the shelter by saying we know how to work virtually. No, no, no. Try to continue establishing the linkage and connection in real life, and do it with people whom you like, and also with people who are not so very like. Now, finally, I wanted to say one other point, perhaps, and that is about the burnout. Because burnout is currently being described as a major danger for many people, even in psychiatry. And of course, burnout is a consequence of many factors. There is a burnout is your the conditions of work. Maybe the salaries are miserable, or the bosses are terrible, etc. It's also an overburdening with work, which is also contributing, and particularly for people who have a sick member in the family, a child, many friends, obligations, etc. So there are too many things at the same time. And I think that one advice that I have given in when we do courses, which is very important as well, is a good counter action to burnout is to reserve a little time every day just to yourself. Just sit there, think a little bit about what are things, can I change something? Maybe something that makes me very unhappy is not so very important. Maybe I can forget that. And maybe I can speak to this fellow whom you don't like so very well and we'll become friends again. But give your time a brief period within the day, every day, in which you think about what happens with me, who am I, where do I go, what is my life like. It's not easy to find a little period of time, but I think you can find it, and it'll be a very useful time to have. So thank you very much again for inviting me to make these comments, and I'm delighted to be present with you for a little while more so that we can also have some questions and maybe some further discussion. Thank you.
Thank you very much, Prof. Sartorius, for your insightful comments, and I think it can be inspire us all. And we now proceed to question and answer session, and we invite you to raise hand first if you want to ask directly to Prof. Sartorius or Dr. Dia or Dr. Gina or Dr. Leo, please. Is there anyone to raise hand to ask directly to our speakers? Okay. I start with a question from chat, Prof. It's for you from Dr. Talita.
Yes. Sati, I would suggest, if I may, that you select the questions that you will give me. You select which one you want me to answer in which order. Maybe some will be writing in Indonesian, and so I think that you select which questions I should answer. So I will start with the one that Dr. Talita has. It's originally a question that she writes to everyone, not to me personally.
But we all...
Let me just read what she says. Yes. Now, one question that she is asking about is about how to collaborate with how to diminish stigma of mental illness, I think, which is making people avoid psychiatrists. And she says, mental health is still a taboo. How do you deal with it? The question of stigma, I would like to suggest, maybe if you are interested, we have just published a book a few days ago, which you may wish to read, and which is called Paradigms Lost, Paradigms Found. And it is a summary of the work that has been done worldwide on fighting stigma. And it's published by Oxford University Press. And I think that if it's possible for your university or yourself to buy the book, I think it's a book that is of considerable interest, and in fact speaks about many of the measures that have been taken, measures that have been taken by departments, but also measures that we can take ourselves. What we can do ourselves about stigma is also very important. First, we have to convince ourselves that we are somebody. Because many psychiatrists say, oh, nobody likes me, I have to avoid these people, etc. And they are not really thinking sufficiently about the way in which they can present themselves a little bit better. One important feature being a doctor is not to avoid physical illness. If a patient comes to you, or people who have a physical illness, you should remember that you are a doctor and that you should deal with the comorbid conditions, with the conditions which this person has. You should, because in a way, being a shrink means that you know nothing about medicine, while in fact you must present that you are a doctor who knows what doctoring is all about. You are dealing with one particular aspect of illness, but you are also capable of dealing with others, sometimes asking for advice and sometimes dealing with you yourself. And the notion that a psychiatrist should have a lot of attention to comorbidity that exists in psychiatry is very important, because these people, many people will come and will understand that. Another point maybe that comes with that is there is also how do we collaborate with the so I see that I have done, I'm talking without necessity. The question was really addressed to Gina, not to me.
No, the second one is from Dr. Gina, Prof. The first one is for you.
Okay. All right.
So the second one, please, Dr. Gina, to answer the question.
Okay, thank you, Dr. Sati, and thank you, Dr. Talita, for the questions. So the question is about how do we deal with the issues about self-diagnosis in the among the Gen Z, especially in Indonesia. I think it's an interesting time for us to be a psychiatrist nowadays, because we're in a transition era. We've seen the results of the senior generation of psychiatrists in destigmatization of mental illness, and therefore we're here with the current young generation who are more awake about mental health issues and its related problems. However, there are challenges about self-diagnosis. I remembered from Prof. Sartorio's talk during the 2017 World Congress of Psychiatry in Berlin that on doing our work for destigmatization, there is one thing that is important for us to do, which is to teach the layperson about mental health problems, but we teach them not to judge, not to give the label, and not to diagnose. So the importance of educating the society about mental health problems is for them to be able independently differentiate their state, whether they're in a good condition or need some help. So it is important for us to help them differentiate between the condition of having problems, me having problems, and me being treated for my problems, but not to judge themselves, not to judge other people, not to label themselves, not to label other people, and not to diagnose themselves or to diagnose other people. And the other thing that is important, aside than teach them how to differentiate between having problems and being treated for their problems, is to teach about self-help. Prof. Sartorius also taught us to help people to be able to help themselves, to teach them how to live with their impairment. So it will
to some extent, it will ease our job as a psychiatrist, because the society will filter themselves the severe cases that will go up to the specialist services. And it's also some kind of empowerment, because we all have power to help ourselves. And this kind of spirit that we need to transfer to the society, so they know their own condition, they're being constantly aware about their situation, and then they have ability to help themselves using their own resources, and know when to seek for further help. I think that's what's important in the current situation. Thank you.
Thank you, Dr. Gina. Thank you, Professor Taris, for the answer. And now we have question for, live from Dr. Bianda. Please, Dr. Bianda.
Okay, thank you, Dr. Sati. Thanks for the insight to Dr. Norman, Dr. Dia, Dr. Gina, and Dr. Leo. I want to ask, maybe can give tips to me and to all participants on how to adapt and survive, because resident education is not only learning, not only studying, but also organization and personal life. Thank you. Maybe the first one for Dr. Gina.
Okay.
Sati, there was a question, I think, previously on how to do with research.
Yes, but
do you want me to say a word about that?
Please, if we can do it, Prof, now, and then we can. Dr. Gina will ask the previous question. Please, Prof.
Yeah, I think that it's an important question, because doing some research not only will get you publications, but also keeps you actively interested in what goes on, and it changes your life a little bit. Now, the problem with young people doing research is that they are terribly conscientious and ambitious, and they want to resolve the world's problems. But that's not so easy. Problems of the world are very complicated, and therefore doing simple research is very important. What does it mean, simple? One, research that can be combined with your work, so that you don't have to do separate things, but you can combine it with your work. Two, it shouldn't take much time, because if it takes much time, you will have to neglect other things. Three, it should be in an area that is easy to publish. Now, I'll give you one or two examples of research that is relatively easy to do, and which can also be published. One is a research that is done by collaboration with other people, where you have particularly if you manage to have a friend in some other country, papers that come out with authors from 2 or more countries are much more likely to be published. Second, you have a whole series of studies that are called the census studies, in which you take the situation as it exists, as a census, and you do not have to do additional work. The census study, some of you may participate in the study which is called the REAP study, the REAP. This is a study which I suggested many years ago, and into a meeting groups, and then the group met, in which the people looked at the question, what is the treatment of schizophrenia today in all Asian countries? And what they did is they took on one day, they took all the people with schizophrenia in their hospital and wrote down what kind of a medication they have been given. And although the total work for that was very short, maybe 2 or 3 days, this study has gradually grown by doing censuses regularly, and is now having about, I think about 150 publications, and many people have participated. I think there's also some people from your country who have participated, but it's a type of study that is called census studies, in which you take the situation as it is now, and you compare it either with situation tomorrow or with another place. So you could say, are all the Indonesian hospitals providing the same dosage of antipsychotics to people with schizophrenia, or are they widely different? And you will see that they are different, and that is a publishable paper. So I think that census is one group of studies that you can do very well. Second one are studies that are done on the basis of records, where you don't have to go out. So there is a number of simple studies, and the main rule for you should be that no research that you do should take more than 1 or 2 hours per day. And the second rule is try to find a group of people with whom you will work. Don't do it alone.
Thank you, Prof. Sartoris, for the answer and for the response. And can we proceed to Dr. Gina for the previous question about how to survive?
Dr. Sati, sorry, can I add something?
Yes. Please, Dr. Dia.
On about the research. So I think it's important for us, or the psychiatrists, to maintain the research. It could be start in the small research in our workplace. For example, case report, or something, data from the medical record. We can do something, and we can present it in all of the national or international event. So, but the more important is we have to build to eager about the research, because I know that we have many data, but it is like just data. So I can do something small. For example, when I was in the drug-dependent hospital, in every 2 years, every year, I just put some data in this hospital and submitted the abstract from the CPDD meeting, an IDA meeting, and present it over there. And I got some travel award like that. So I hope the psychiatrist, Indonesian psychiatrist, has an eager and start with the small research with the data in your workplace. Thank you.
Thank you, Dr. Dia, for the comment. And for Dr. Gina for the previous question.
Okay, thank you, Dr. Sati. Hopefully, Dr. Inke can get us a satisfying answer from Prof. Sartorius and Dr. Dia, and keep your spirit up to do all the job. And remember to take care of ourselves as well, so not being overwhelmed and prone to burn out. Continuing to the question from Dr. Bianda, I think it's still somehow related with what Dr. Inke asked, because at some point in our life, we will have many things to juggle with our head. And actually, the overwhelming situation is not going to stop after we graduate. After we graduate, there are a whole amount of another challenges that, like Prof. Sartorius mentioned before, we might have to do unpleasant things. We might to meet unpleasant people, but there are things for us to do as part of doing our job. So the tips to survive is what I'm personally practicing is what Prof. Sartorius already taught us before about having a little time in our day to think about yourself, about why am I doing this? Do I really want to do this? What am I going to do next with this? What makes me unhappy in doing this? What makes me happy in doing that? And I think that kind of space is important for us to put the interest back in place, whether we still being motivated to do the things that we used to do, or the motivation is no longer there. And then if we know, or if we realize that the motivation is not there, then we can ask ourselves, can we find another motivation to do this thing? Or maybe it's time to move on, to find something else, to do something else. And what's important to survive in being in a condition is to know whether we want to be in that condition or to fight for that condition or not. I think it's quite similar with other aspects of our life, because this is the life that we choose. This is the life that we have the power to live on, or to change that kind of life. So I think always look back and look forward to decide for ourselves what are the things that we want to do. And don't forget to take a rest, because if we're having lack of sleep, me for speaking from the personal experience, if I break my sleep routine, and I cannot think for the other day. So sleep is one of the most important thing for me. So maybe we need to look at ourselves and find what is the most important thing for us to keep us going, besides the motivation, and then what kind of other routine that help us to function well. I think that's all that there is. I think maybe other speakers have their opinion.
Is there any opinions for other speakers? Please, if you have other opinions or additions to Dr. Gina. If you don't have, so can we proceed to the next question, Prof, for the chat box? The question is from Dr. Dina Faizatur. She asked about, the more I learn about psychiatry, the more I know myself better. But in the other hand, I picture myself as a container to other emotions. And sometimes it's quite difficult to cope with my own feeling and others, and at the same time. Maybe any suggestion from Prof. Sartorius and Dr. Dia, how to regulate those emotion flood for us as new residents, like how to make the container bigger than before. Please, Prof. Sartorius and Dr. Dia.
Prof. Sartorius first, I think.
Please, Dr. Dia, you start.
Please, Dr. Dia.
Yeah. That is a joke. When I get trained in psychiatrist, what is the reason you being a psychiatrist? You already has a mental problem, or right now you have a mental problem, or you will have mental problems. Is it the joke in our environment? Yeah, it's I know, but sometimes we have to realize, but as a psychiatrist, we have to provide our emotion, our feelings, or anything related to emotion, because I will deal with the people with the big problems, and also something it influence our emotion. Then in my experience, when I got burned out or feels that the situation is very mess, I try to do living the situation, and so I think that it will be better and better by year by year, because after, right now you are still in the trainee, but after you got the practice, you can manage yourself, as a being psychiatrist, and you know when when the time that I have to get my me time, and also to get another activity for release our burden as a being, as a psychiatrist. I think this is my comment. Thank you.
Well, I don't think that you should worry about the flood of emotions. It's just fine to have them. The more you have, the better it is. I mean, you will finally find out that the world is a complex place and that you have to find your place in it. And that's, like anything else, requires an effort and time. So I think that you shouldn't worry about it. It's perfectly fine to do it. You suffer a little bit while you are younger, but gradually you organize yourself. So not to worry about it. It's going on fine. And the fact that you feel that there is a flood of emotion just speaks that you are a good person.
Thank you, Prof. Psychiatrist and Dr. Dia, for the comments, and we proceed to the next question from the chat box from Dr. Vidina Mediola. As a new psychiatrist in the industry, and you said that it's good for us to keep doing research to maintain our interest in learning psychiatry, but how about us that don't work in the university-based hospital? How we can keep doing research and publish the paper, because the research that you said before, it seemed big, and how to maintain it, and how to maintain the optimism to learning and doing research even we don't work at the university or university hospital. Thank you very much. Prof. Sartorius, please.
Well, I think that the answer for that is to have friends, because I think that you will find that working in a hospital far away from anybody else is quite difficult to continue doing research. Some people have done very excellent research. Very often they have been producing amazingly good quality papers about mental illness. But I think the answer to your question is establish a network, be in contact with other people. They will tell you what kind of data they are currently collecting. You will join them. You will join them by what you have and what you have accessible. And remember that hospitals very often have things that are unfindable in university departments, both in terms of type of patients and in type of problems, etc. So my answer to you is establish friendships. They're quite nice anyway, even if you don't do research. It's very good to have friends, and you have to build friendships. Friendships are like flowers. It's easy to see them, but you have to spend a lot of time watering them in order to grow. So make your friends and keep being with them. And as time goes by, they will involve you in research which you are doing, which they are doing, and you will do research as well as have a friend.
Thank you, Prof. Sartorius. Is there any comments from other speakers, Dr. Dia, Dr. Gina, and Dr. Leo? Okay, if there's no addition, so we can proceed. Next question, again from the chat box, from Dr. Vivi Sharif to Prof. Sartorius and Dr. Dia. Number one, how to protect ourselves from the overload and overburden of work as a psychiatrist. Providing psychotherapies to many patients really involve a lot of our energy, time, and emotion. How to manage workload? Is there any tips for us? And number two, please advise how to improve career. Do we need to take subspecialty program or other academic degree or else? Thank you very much. Please, Prof. Sartorius or Dr. Dia, maybe ladies first.
Yes, always.
Okay.
Please, Dr. Dia.
Thank you, Dr. Fifi. Yeah, it's about the overload of burden of your works. Yeah, it's a typical in Indonesia. In the hospital, we noted we don't restrict the clients. Yeah, in practice hours, if there are 20 clients, we also just accept them as a client at the time. So I think it's better if we have agree with the this is the call to just how many clients just we can accept at this time. For example, no more than 10 clients, yeah, if in the private practice. But in general hospital, especially in the government general hospital, it's hard to do that. But we can also make it strategic and doing something like we just train or prepare some of the general the medical practitioners, the general practitioners to be as assistant, and then for the first time before we refer to the psychiatrist, they can also making a interview, and then for the intervention or the psychotherapy and another intervention can delivery by the psychiatrist. It is just my experience, yeah, because when it was in 1998 until 1920, there are a lot of people using heroin, because I'm in the drug addiction. In one day, in the work hours, I can examine more than 40 clients. It's make me very tired, and it's a big burden when we try to do like this, doing together with our general practitioners. And the second question is about the subspecialists or the other. I saw that there, Fifi asked about advice to improve career, and we need to take subspecialists. In my opinion, it is important to take a subspecialist, so everyone can know us as a you are a specialist in addiction, you are a specialist in community psychiatrist, you are a specialist in consultation relation psychiatrist. So we learn focus on one subspecialist, and I think it's better for the psychiatrist. If we can do all of the problem in mental illness, but it's better if we have a subspecialist, so everyone or the people can know us as a specialist in community addiction or in the geriatry and others. This is my advice, Dr. Fifi. Thank you.
Thank you, Dr. Dia. Please, Prof. Sartorius.
I think that the important thing, not only for psychiatry, but also for life, is that you learn what is more important than something else. Sometimes people do not require psychotherapy. All they want is that you say good morning to them. And sometimes a smile will do, and it's enough. So that the fact that you will, if you look at all the tasks that you have around you, you will find that many of them can be resolved with much less effort. Some require more time, but learning how to distinguish things which are important or time-consuming from those which are not is a very important skill which you have to gradually develop. You will see that the person who comes to you and says, I have to complain to you about this, that, and the other, and all you have to say maybe is one sentence will be enough. While in another case, you will find that the person who doesn't speak very much, but he does really need your help for many hours a day. And I think learning to distinguish what is more important and what is less important makes you a good doctor, makes you a good person as well. Very important skill, but you have to exercise it and look at other people to see how they are doing it. Because they are sometimes an experienced person does things and you don't quite, you think, I just remember. It's not true. This is a skill that has been very difficult to develop and can be learned. The second point about the subspecialty program or the academic degree, well, don't do it unless it gives you pleasure. I mean, you are currently at a level which is a very respectable, and in the whole of Indonesia, you are less than 1/1000th of 1% of the population. You are the top of the top. There are not very many. There are many people who do not have university degree, specialty in psychiatry, experience, all of these things. So you're already on top. So if you really feel that it'll be joyful for you to take another particular training, remember that that will require extra work, and think a little bit of what will be different if you do it. If you find that it will be minimal difference, then don't do it. If you find something that is really interesting to you, go and do it, because it will relax you. It will give you time, additional time, because you'll enjoy doing a particular part.
Thank you, Prof. Sartorius. I think we can get so much insight from your comments, and as well as from Dr. Dia. And next, we can proceed to the next question from Dr. Hervita. First one to Dr. Leo. Prof. Rahman said that all of us should be a mentor, including for ourselves. I believe it was not easy to become a resident of psychiatry in this pandemic era when we don't have much opportunities to meet the cases. How the way you and your colleagues keep your skills and trying to achieve the education goals. And the second one from Dr. Hervita to Prof. Sartorius. Do you have any suggestion for us as a lecturer, mentor to help our residents to achieving their education goals, especially during the pandemic era? Thank you very much, Prof. Dr. Leo, please.
Thank you very much, Dr. Sati, and thank you very much, Dr. Hervita, for the question. Yeah, I think it is something that very challenging during this pandemic, especially since we have some areas have locked down, and also some of the wards, psychiatry wards now is dedicated for the COVID-19 patients. So the numbers and the opportunities and the likelihood to meet with the patients is significantly reduced. So I think what I experienced together with the friends is, as Prof. Norman mentioned before, is the seed of friendship. And I'm very thankful because my home institution, as well as the organizations of the IPTA, also exercise the conduct of friendship, where we will have each other, and we also technically conduct some discussions weekly or bi-weekly together with the seniors residents, and helping the junior residents to discuss for cases, to sharing their experiences, to sharing their knowledges on how to deal with the patient. And I think that really helpful for the junior residents to have more insights, and also have some difficulties in running the patients. And also from the information from the psychotherapy sections in Indonesia, IPA, they also have some sort of programs to conduct monthly discussions for the psychotherapy cases using the perspective and the approach of psychodynamic, as well as the cognitive behavioral therapy. And I found that it is very useful, because there are also some residents and also some psychiatrists joining that forum, where we can also have some insights and knowledge on how to approach the patients. So I think that is what we can sense togetherness and the unity and diversity during this pandemic. And the message is that we are in this together. And I think that what makes us strong, no matter how tough the situation is. I think that's I can share from our experience. Thank you.
Thank you, Dr. Leo. Please, Prof. Sartorius, for the second question.
This is concerning the additional learning. I think that number one, it is very important to think of changing the content of education. For example, one of the things that would be much more important to learn in the educational period is to learn communication skills. it is not anymore really relevant to talk to people about the symptoms of a disease, because they can read that. And they can read it, and then they can ask questions, and you can help them by answering questions and by seeing a person, showing how the examination should be done, learning how to listen to people. It's a tremendously important skill, and it's very often neglected and is not taught well. So that is one, more emphasis on communication skills. Second, I think more emphasis on comorbidity, on learning to see the mental illness in the context, to think about mental illness in the presence of other illnesses, and the difference between anxiety with a person who has a cancer because he is a cancer, and anxiety which is comorbid with cancer, because they are two different conditions and have to be treated differently. The first one will disappear if you remove the cancer. The second one will not disappear. Even if there is no cancer, it will continue. So thinking about our skills in dealing with comorbidity is the second thing that I think would be important. And the third one is to use free things from elsewhere. There is now a number of psychiatric societies which have webinars regularly. Use them. They are, all you have to do for many of them is to inscribe your name. So you can in fact not let the student himself do the webinar, but take the class, several students, listen to the webinar together and discuss it. See how this is applicable to the situation in Indonesia, what could be done differently, what needs to be changed, etc. So use the webinar as a stimulus, not as a source of knowledge only. So that is how I think you could improve the training of young colleagues very well.
Thank you, Prof. Sartorius. And then the next question is from Dr. Siti Rusdi from the chat box. I am currently a second-year psychiatrist resident in Indonesia. I sometimes find myself feeling quite frustrated with national policy and regulation, or lack of it, which still presents a significant barrier to patients receiving appropriate.
Well, there is everywhere in the world, there are rules. And there are some rules which are very stupid, and some rules which are reasonable, and some which are very important. So the first thing which you have to learn is to learn to distinguish which importance these rules have. Now, for many of the stupid rules, you can avoid them, circumvent them, cheat a little bit, disregard them. I mean, it's unlikely that you will suffer if you do all these things. And there are stupid rules which you have to. Second, there are rules which are so bad, but very important, that you have to fight to change them. That's the second lot. They're completely different from the first lot. There's no point in fighting with rules which are anyway, nobody observes them. But you find one or two rules that change, that would be important for your practice, go after them and try to change, not many of them, but one or two that are central to what you have to do. So it's one of the three styles that you have to take: change, circumvent, or cheat. It's all with C.
Thank you, Prof, for the trick for us how to deal with this situation. And there's also a question for Dr. Dia, who have such a vast experience for working with government for psychiatrists resident in training, who would like to contribute to the changing such a formidable extrinsic factor. In your opinion, what's the most important skill we need, or where can we start? Prof, Dr. Dia and Prof. Sartorius.
Okay. First, I will mention. I will talk about the mention of Dr. Leo before. Yeah. We cannot change the situation, but we cannot change. We can change ourselves. That's right, Dr. Leo. Yeah. Yeah. Working in the government, it's sometimes it makes us frustrated because of the situation, and also the policymaker, they don't care about the mental health problem. Yeah, but I think what is the skill of you as a second year of the training of psychiatrist? Yeah, you have to prepare yourself. Sometimes we can give an ideal treatment, ideal services, but it could not provided because everything is limited and everything is very hard to get like that. So just do what you can do, the optimize the resources that you have, and then just being you try to do good communication with the clients and with the other people, because it's not easy to influence the policymaker. For example, until now, we can change the regulation about the suicide. Suicide is still excluded for the national insurance. Even we have this Dr. Hervita here. We try to give you the situation for the to the Ministry of Health, but it's not easy. But I think for us as a psychiatrist with this condition, we have to be never give up. Yeah, we are still survive and fighting. Yeah, to how to the policymaker more aware about the mental health problem in Indonesia. So we enjoy with the as a psychiatrist, Dr. Siti, who is that Siti. Okay, this is my comment, Dr. Sati. Thank you.
Thank you, Dr. Dia. Is there any addition from you, Prof. Sartorius?
Yeah, well, I would suggest that there are three things that respond to your question. Number one, you should learn how to speak. It's a very difficult skill, how to present yourself. You will never have enough time to describe everything. So you have to learn how to express yourself very clearly so that the person who listens to you can understand immediately. Because even when you get to the government people, they're busy people as well. They're not particularly interested in what you have to tell them. So you have to attract their attention and you have to use the very small window of opportunity while they listen to you to shove in the message. Very difficult. Now, second, you should know the facts. You should not we have to do this, that, and the other. Unless you have really studied, you know exactly what the situation is. You say, there are too many people who come to the hospital. Well, wait a minute now. What does it mean, too many? How many have come? Has this changed over the last year? Is it now more than before? Are these people now all more old than previous, etc.? So you should have more facts than anybody, and you should be able to use them. Because if you have a question after you have spoken, you'll have to answer with confidence. It's the second thing. And the third one, you should know what other people have done and what kind of solutions exist. Because let us say that you come to the government person and you explain to them there is a rule which is bad. And you have said this in such a manner that the government person says, you are right. What should we do? You must have an answer. But it must be a good answer. You must say, we shall do like this because other people are doing it and it works. Or I've tried it out and I know how it works. Or people who have done it this way. So you must have the answer to the bad rule. If you don't have an answer, don't go and complain about it, because they'll tell you, so what else can we do? So be sure that you have an alternative, that you know how to speak, and that you know what goes on at present, that you are in control of the facts.
Thank you, Prof. Sartorius and Dr. Dia for the insightful answer and comments. And now we we are in the end of this webinar, and thank you very much for Prof. Sartorius, Dr. Dia, Dr. Gina, Dr. Leo. We have a fruitful webinar. I think I can conclude it because so many methods, so many inspiration, and so many tricks that we adapt to our life to be how to deal with this situation, and hopefully all of us can get any benefit from this webinar. And for your information that we will have 2 more with this webinar with Prof. Sartorius and many other speakers, and see you for the next webinar, and have a good day. Prof. Sartorius, thank you very much. Dr. Dia, Dr. Gina, and Dr. Leo. Stay safe, Prof. Dr. Dia.
Thank you. Thank you. Thank you, Prof. Norman.
Thank you very much. Prof. Norman,
Should we take a picture together?
Yes.
Okay.
Yes, why not?
Okay. Who will take the picture, Dr. Leo? Or
I think yeah, we try. Maybe Dr. Giana or Dr. Sarah will help us to for the photo session, Doctor.
Everyone, open the camera so we can take the picture together. I will guide 1, 2, 3 for the first frame, and the second one. 1, 2, 3. And the third. 1, 2, 3. The fourth. 1, 2, 3. The fifth.
Okay.
1, 2, 3. And wait, last one. The sixth frame. 1, 2, 3. Okay, done.
okay.
Thank you.
Thank you very much. See you next
you,
webinar, Prof. Stay
Okay.
safe.
Thank you.
Prof.
Bye.
Thank you, Prof.
Bye.
Sartorius. Thank you, Dr. Dia, Dr. Satya, and
Yeah.
also
Dr.
Dr.
Dia, thank you
Leo.
also.
Thank you, Dr. Dia.
Sama-sama.
Dr. Dia.
Semangat. Sukses
Oke.
semuanya.
Terima kasih, Dr. Dia.
Calon-calon
Dr.
pemimpin. Sukses semuanya.
Thank you so much.
Terima kasih banyak, Dokter.
Welcome ya. Oke, izin deh.
Ya, silakan, Dokter. Kita mau ini dulu nggak, Dr. Leo?
Mau ini dok diskusi untuk saya mungkin buatkan breakout room ya, Dok. Saya buatkan.
Gina, masih bisa kan? Masih ada waktu kan?
Bisa.
Oke.